demonstrate. Move these if I can reach them.
I might have to back this up just a little bit.
Yeah, take it on back where you need it. I'll get it started. Go ahead.
This is very, very relaxing for me, right?
Yes, very relaxing. Let me slide it back just a little bit further. That's so we can see everybody. Hey, everybody, sorry, we're getting it set up. Oh yeah, we can see you. Just turn a little bit.
You can cut me off halfway. I'm fine. I don't want to be seen that much.
Oh yeah. Okay, we're just waiting on Krista. We already got 17 people watching this. So let me introduce you. This well, you know Anna. We're out and we're out visiting, and this is Dr. Pat. We met her at an event a few years ago, and you're a doctor, right?
Yeah.
A doctor, and
I'm family practice.
Family practice. Yeah. So it's you know, and it's lately it's been about how to do it without going to the doctor, right?
Right.
Okay.
I can talk about how I had babies before I became a doctor.
Yeah, before she became a doctor, how she had babies and stuff like that.
And how the medical profession really messes it up sometimes.
Well, see, so we're really set up for an exciting show. We're waiting on Krista. We had trouble setting it up. So as soon as Krista gets here, we'll be able to set up with the comments, and we'll be able to figure out how so we can y'all can ask her questions and everything. But while we're waiting on that, if you want to go ahead and talk a little bit, I mean, they don't have to be questions, but
Sure.
Tell us a little bit about having a baby without a doctor.
Well, I've never done that.
Oh, okay.
I wanted to have home births, but I had my baby. I have an RH incompatibility. And back when I was having babies, those long many years ago, babies did die of that.
Oh.
So I had my babies in hospital in case the genetics worked out so that my baby might have had a problem. And then they figured out what to do to avoid that right after my last child was born.
Oh, okay.
But anyway, so I had my own fights with the medical profession from baby to baby to baby.
From baby to baby.
But I did have all of my babies without any medication at all. And back in the 60s and 70s, you really had to fight for that. I had to have a list of what I did not want done at the base of my bed.
Yeah.
Do not do this, do not do that, et cetera, et cetera. But over the years, things have calmed down a lot when you go and have your babies at a hospital or with a midwife, and they're better now.
They're better now?
Yeah, you don't have to fight.
I was looking at it. She gave me this piece of paper, and I was looking at it, and I'll try to put this in the description below, but it'll probably be tomorrow before I can get this in the description below. But it's like list of herbs to avoid, list of.
Well, it's a pregnancy and emergency childbirth. It's just some supplies to have on hand.
Oh, okay.
This is if things are really bad, and if there's somebody in your household or in your tribe that is pregnant or will be having a baby. These are things to have had ahead of time. And a lot of them are things that are pretty simple.
Pretty simple?
Yeah.
Okay.
Like a turkey baster.
A turkey baster? Well, we all need one of those anyway, so.
I mean, when baby's born, they have milk in their house, you can push it out with that. You don't have to have something in a sterile pack.
Oh, okay.
But, anyway, these are just things that you should think about.
You need to get to the comments real quick, okay? Chris is getting to the comments real quick, and so that we can see and see what you're asking and all that. We don't even know who's here right now. Me and Dr. Pat are looking at us.
Okay, so I just kind of looking ahead as to what childbirth would be like if, you know, if the EMTs aren't coming, if there's no way to get to somebody who is an official person who helps with childbirth. And you should have a list of the things that a pregnant person should avoid. There are herbs that should be avoided, but you need to look that up and have it ahead of time. You have a list of foods and herbs and foraged food that contain things like iron, high protein, vitamin C and B, things like that, so that you know how to feed a pregnant person. Avoid alcohol, just what you can. I think it's a good idea to have folic acid supplements. You don't want to take too much. Everything these days has folic acid supplemented in it. I mean, milk and your bread and everything. But if
that helps in the consumption of calcium, right?
well, it helps develop the skull and the spinal cord. Now they're beginning to think if you get too much folate, you might get the tongue-tied stuff. Yeah, which is going too much in the other direction. But if we are having problems and you can't get things that are already folate supplemented, then you should have a store of that. You should have a method of record keeping. One of the things I like to talk about is that, you know, what are the things that can go wrong during pregnancy? And one of them is urinary tract infections, which can really harm the baby.
Sorry, should they pull up on a computer behind there so you hear us talking from a minute ago?
And blood pressure is an important thing because when a person is pregnant, their blood pressure is much lower. And actually, if your blood pressure comes up to what's normal, that becomes a sign not so good. My daughter-in-law almost died of that because her blood pressure was, quote, normal, and that was too high for her. It's too high, yeah. So,
Krista did that too.
So Krista had that, yeah.
So that's why Anna has cerebral palsy. So
anyway, you know, if you're getting ready for, you know, taking care of people in your home, it's really a good idea to have the called the sphygmomanometer, the thing to do blood pressures with. You know, it's nice to have the ones that are automatic, but if eventually you run out of batteries, it's nice to have the normal
blood pressure
manual, right? And then I have the urinalysis strips. Now these guys have already gone; they're expired. But they'll tell you if there's protein in the urine and if there's infection in the urine, which are the two things you really want to be watching for.
What is protein? Oh, go ahead.
Suburban Hillbilly says, does this mean Krista is pregnant? Woohoo!
Because you asked about it.
Anna says she hopes so. Tell Anna that Emma says hi too. Dolphin Man says, hello, Dr. Pat. Glad to see you here.
Nice to see you too. I think. Do I see? No, I don't see anybody.
You don't see anybody.
Oh, okay.
They're in the comments.
Let me see. Tell Anna Banana that Bandana Grandma says hi. Hey, Dog. One more minute.
Grandma Banana.
Simply Circus says hello, Doctor.
Hey, Simply Circus.
Hey, everybody.
We're going over, if you just got with us, we're going over, yeah, you need to come up here too.
Like
So.
pregnancy and delivery under austere conditions.
Yes,
Okay.
but y'all can also ask us other questions too, if you don't mind.
Sure.
If you know, because she is a doctor, so that's what's important. So.
I sort of like to, you know, sort of at the beginning, sort of say some of the things that people should think about having on hand. And so if you want to do that, that's fine. If you don't, that's fine too.
Yeah.
But it's good to have some books. I have a really, really nice book called Heart and Hands. It's a midwife's guide to pregnancy and birth. So natural stuff.
Let me show them that real quick, if you don't mind.
Okay.
Try not to get the reflection on there. Sorry. It's reflective. There we go.
There. Oh, great.
Heart and Hands.
Who's it by? It's by Elizabeth Davis.
Elizabeth Davis. All right.
Okay, and then this one is Gentle Babies, and it is about pregnancy, childbirth, and early childhood using essential oils, things that help with delivery and what you can use with babies. So, I mean, you can find all kinds of books about this, but it's good to have read ahead if you are going to be facing this sort of thing. But anyway, you need a record. I would say you really should have a way of record keeping, like a clipboard or something. Because you need to know what the blood pressure was 2 weeks ago.
Yeah.
And you may need temperatures, or just to sort of you can look back and say, oh, what's happening here? It has soft tape measure for measuring the baby. And I would say you should have gloves. These are non-sterile gloves, throwaway type things, latex free, and they're really great for protecting the people who are helping with the delivery. This isn't for protecting the mom, but if anybody has had a baby, they know that it can be a pretty liquid experience. Which brings me to another thing that's really good to have.
A liquid experience.
It's a liquid experience. I have bought up a bunch of these $1 plastic shower curtains. Get them at any dollar store or anything, because if there's a lot of fluid. It's a good idea to have plastic on the ground and on the bed or wherever you're going to be. I always have a bunch of pieces of fabric ripped up. It's really good to wash them well, dry them in the sun, and then just put them in plastic bags. So you have, they don't necessarily have to be sterile, because having a baby is not sterile. And it's a good idea to have a few packages of the sterile gloves that are the ones that, for surgical stuff. Because if you do need to assist with the birth in some way, you need to kind of look in and see what's going on, or actually reach in and untangle a cord or something. Well, you want to have sterile hands for that. So, but most of the time it's just a matter of protecting yourself from any liquid.
Sammy Joe asked, could you tell us what kind of doctor Dr. Pat is?
Okay, I am a MD. I did a lot of OB rotations because I'm a family practice doctor, and I plan fully to do deliveries. And my last year of residency, my husband was transferred to Florida. And in Florida, they don't let family doctors deliver babies. So I actually really missed it, but then I really didn't miss being called in the middle of the night 3 nights a week about somebody who had something going on in the ER. I did get to sleep a little more because I was not doing OB anymore. But
What did you do down there?
just plain family practice.
Family practice,
Yeah.
okay.
People and children, lots of adults.
Mm-hmm.
Yes.
So what would you do if the baby was breech?
Well, sometimes you can turn them. You could deliver a breech baby. I've seen them delivered. In this day and age, if you go to the hospital with a breech baby, they're going to do a C-section. Because the head is the largest part of the baby, and it's the battering ram. It takes you through the cervix and out. And if you're going through with a breech, that's soft, it's hard, the delivery is really difficult to get the baby through, and the head can get caught. But if you're under austere conditions, you do what you can. I mean, and people have anointed the baby and prayed, and the baby has turned. I know there's some things with King Institute, there's something with a certain type of touch. You're familiar with that?
TKM.
TKM, okay, yes, there are. I have known people who have actually turned a breech by doing that. I don't have any experience in it, but it's really something worth looking into with TKM.
I agree. I wanted to go take their classes in Texas, but my husband says you're not going that far away. So, okay, so you would absolutely turn the baby around. No,
If you can.
If you
if
can.
you can. If not, you would do a C-section.
I couldn't do a C-section.
What if it was a grade down scenario? What would you do?
You would deliver the baby breech and pray through the whole thing. The thing is that under austere conditions, there will be
Breech babies.
There will be deaths. And you just have to understand you're not going to be able to save everybody.
I know that's harsh, but you know,
It's
it's
hard,
reality.
But the good thing is you can turn a breech baby around.
Mhm.
Yeah.
I've actually been at a regular delivery of twins. And the first came out head first, the second came out breech. She was one of my mentors, and she was so much fun to deliver with because she said, just wait. We stood around and waited for 30 minutes for that second baby to come out. No worry, everything's fine. It was really nice.
Wow.
So,
I'd have loved to have been there.
yeah, there were people I did not like to deliver with. That's so uptight now. Okay.
I know. I've heard stories like that before.
Okay.
What percentage of deliveries are breech? Green Gables Homestead asked.
I really don't know. That's something you might find on the internet. I really don't. You know, I have been I finished my residency in 1989. I may look very young, but I was 43 when I started medical school.
Yeah, you finished your residency when I was born.
Okay. So I have not delivered a baby since then. And I had delivered all my babies before I went to medical school. So I'm not totally up to date on all of this, but I do have some first sense about it.
Wendy Benjamin said one of my grandchildren was born butt first, almost lost both of them.
Mm-hmm. Yeah, that's right.
I have to cut umbilical cords, often says.
Mm-hmm.
And that's about everything.
Yeah. I just want to be sterile. It's good to have clamps of some sort, something to, you know, and there's no hurry to cut an umbilical cord. I think the problem is that one of the things we need to remember is childbirth is normal, you know, and it's not necessarily painful, it's hard work. Very, very hard work. The same word in Hebrew in Genesis is that man will, you know, get his food out of ground with hard labor, and women will deliver their babies with hard labor. It will be difficult.
What about after childbirth? What about the placenta and all of that?
Mm-hmm. Well, the placenta comes a little while later, and you know the baby is born that's the third stage of labor. The baby is born during the second stage, and you just wait. You wait it out, and
It'll come out. Just
it will be pushed out. You do not want to tug it out, because if you start trying to pull a placenta out, you can leave pieces behind, and then you're really in trouble. I mean, I would expect that a lot of you have delivered animals or helped attended at the deliveries, and an awful lot of things one of the things to remember is don't just do something, stand there.
Don't just do something, stand there.
I like that.
Don't just do something, stand there. That's good.
Same applies to seizures.
And what are some of the herbs to help with pregnancy?
Well, there's an awful lot of them, and I'm not. I think it's a really good idea if you have a pregnancy to start looking into it. You know, there's going to be a lot in the books. You want to have just a healthy. There's a few things that are contraindicated, and I don't know exactly what they are right now. I can't give you like a long list. Like herbal medicine is incredibly a huge topic.
Yeah.
So.
I can guarantee that it's a huge topic. You know.
I remember your class at Short Creek, and so I still have your notes.
Oh, good. You should have brought them along. I found this from last time, and I realized I put some things in here I wouldn't put in there now, which is having ampicillin around. I'm not sure we should do that anymore. I think you're better off with something like usmia tincture and elderberry tincture and things like that to fight off infections.
I brought all my Bible stuff.
Yeah.
So I left my homestead stuff alone because
Okay.
So it becomes
One of the
like-
things I would do if anybody, if you're going to be having a childbirth, I would see if you can find some shepherd's purse. Does everybody know what shepherd's purse is? It's an herb that tends to grow in places that look like it's really a yucky herb. I mean, it's just like a little dry thing. And the little tiny seed pods are the shape of like a heart, like a shepherd's purse. And in every language, whatever they're called means shepherd's purse. And it actually is used after delivery if you have a problem with bleeding. It helps to really contract the uterus.
Do you put it on it, or you just drink it, or
Yeah, I can take it by mouth.
my mouth? Okay.
The thing is that after delivery, if there is a problem, the ways people lose babies.
Let me show them
are-
this one.
Yeah, that's just plain old vodka on shepherd's purse. It's all chopped up. It's been sitting around since April of 13. And I like tinctures because you just make them and you can have them forever.
Yeah.
Whereas if you make something with sugar, it'll get spoiled. I would always have that. I think most herbal people who deliver babies usually have that in case of a problem. But if a woman has too much bleeding at the end of her delivery, she really needs to be breastfeeding that baby immediately. I mean, there's no reason at all where that baby has to be taken off and cleaned up. The baby should be just wrapped and get as much skin to skin and start that baby breastfeeding immediately, because the action of breastfeeding releases oxytocin, which is the thing that makes you let down, and it also contracts the uterus.
Oh,
Can I tell a really interesting story about that?
sure.
My second baby breastfed for 2.5 years, and I went to my 1 year postpartum checkup to my OB. And this was 1967, well, it'd be 1968 at that point. And I was still breastfeeding him quite a bit. And he did the exam and he said, "Oh, my dear," he said, "if you ever want to get pregnant again, you better stop breastfeeding that baby, because your uterus is hyper involuted," meaning it would become very, very small. And because of all the breastfeeding, it's because it really clamps it down. And I went home and I thought, I'm not ready to stop. I do want to have more children. I was really upset. And then I realized I was the only normal 1 year postpartum woman he had ever examined, because nobody breastfed up for 2.5 years in those days. So everybody else was abnormal and I was normal. And I did get pregnant again not too long after that.
So we didn't know what he was talking about.
Yeah. But anyway, it does really clamp down to breastfeed, and that's really important. The other thing is that they will actually do a lot of massage to stimulate the uterus, because when it clamps down, it stops the bleeding. And also unattaches the placenta from in, because you have the uterus here and you've got the placenta on the wall, and if it clamps down, it crunches off the normally crunches off the placenta, so it will come out normally. And then you really kind of need to look at it to make sure it's all there. There aren't pieces missing.
So you need to know what one looks like, right?
Well, they're kind of all one piece, yeah.
Oh,
And actually, if anybody watching this, I'm sure you guys are attending births, you have to kind of see if at some point you can look at the animal placentas and see what they look like.
But if there was a woman that needed shepherd's purse, how much would you suggest giving to her?
I would just start giving her like 2 or 3 dropperfuls
Okay.
until it slowed down. There's also an essential herb called cypress that stops bleeding. But that does it more for somehow stopping the bleeding process. It doesn't clamp down the uterus.
Would horsetail work?
It might. I don't know that much about horsetail. I thought I had it and I was going to read up on it, and turns out it wasn't horsetail.
I have some.
Oh, you do?
I have some. I can give you some.
May I have some to plant?
yes.
Oh, that would be great. I'd like to learn about it because it's great for arthritis and bones and joints and everything.
I
So
knew
is
it was good for.
moringa.
I knew it was good for.
So is
anything.
moringa.
Moringa. Oh, I want to get some moringa.
Oh, we should have brought you some.
Yeah, yeah,
I see you guys a lot.
Yeah.
yeah.
Yeah. So anyway, let's see. Trying to think if there's anything else here. I think it's a good idea to have a good supply of antibacterial, antiviral tinctures around, because most of them are safe for the baby. Things like usnea.
Mhm.
Everybody know what usnea is?
No.
It's the stuff that looks like an old man's beard hanging from the tree.
Oh, yeah, I know what that is.
Okay.
Yeah. I go by and I eat that, it tastes like
Yes, it's
dirt.
it's high protein.
Yes, it tastes like dirt, but it's really, I know a little bit about it too. It actually high in amino acid, right?
Mhm.
And it actually fights proteins in cancer, right?
I don't know about the cancer angle, but that's good. I should look
well,
into
that's-
that. Just means I haven't seen that yet.
No, Daryl Patton's one that told me
Yeah,
about that.
That's where I learned about
That
it.
means we need to incorporate it into our breakfast every morning.
It tastes like dirt. It really does taste like dirt. I'll go eat it and I'm like,
Well, it's
like
good
a
to
cow.
carry in your, your everyday carry bag, and kind of, because if you get a wound or something and it's bleeding too much, you can actually stick the oozy in it, and it will be part of the blood clotting process. Plus, it's antibacterial, antiviral.
I know you don't know what we're talking about, but Crystal will make a video on there if she has time. But I know you walk by a tree and you see these little tiny, looks like it's like a plant that doesn't belong on the tree, hanging from the tree, and it's just a little thing about this big, and it just kind of looks like a beard, and so you go pick it off. It's actually grows on the bark, and
They want y'all closer.
I don't have those.
Oh.
Oh, closer together? Yes.
Okay,
Yeah, this is,
and-
you can't really tell from that. It's gray, kind of like a gray beard.
yeah, grayish green.
It's usually on trees that have other kind of lichen on them, and frequently after a windstorm, you'll find it. The branches that have been blown off.
Mhm.
And everyone wants to know about the birth announcement and am I pregnant? No, guys, I am not pregnant as of knowing anything yet. But I like to learn and know how to handle things. We have to deal with this later on. And I took one of Dr. Pat's classes 2 years ago.
Yeah.
And I loved it, so I wanted to have it on video so I can go back and memorize all this stuff.
Okay. Well, there's a lot to remember, and we ought to be putting it on, we ought to be downloading it, because we may end up losing the internet, so that's important. And the thing is, talking to you guys, you might all, some of you might not be childbirth age anymore, but I feel that I need to remember these things, because people will come here and say, I'm pregnant, or I'm about to have my baby, and I want to have my kit ready to help, because we'll be taking care of other people.
And a lot of these things I remembered, it was the herbs and how to handle a breached baby and stuff like that, that I was just like,
We do it more.
What's the pantyhose for? It says pantyhose tied in a knot. I'm just
Isn't
wondering.
that for the umbilical cord?
Shower.
Cat for.
Oh,
newborn.
a cat for newborn, yeah.
Oh,
Yeah, if when a baby is born, you lose more heat from your head than anyplace else. And so it's good to cover the baby's head.
Took me a minute, but I remember.
You think pantyhose, kind of stick it on. It's not real cute, but you can also wrap something around it. But it's just really great to have the baby. The rest of the body can be exposed and skin on skin with mom. But it's a good idea to cover the head. If it's cold, depending on, if you're delivering right by a wood stove, you have to worry about it.
Because if you're holding the baby and you have something on its head, your arms are going to be on one side of it and it's going to be around your skin. It's going to be warm.
Yeah.
It's going to be just like being under a blanket.
And you're going to need, it's really another thing I don't think I have on here is our clean blankets for mom. I remember after my deliveries, it's such intense work that I remember just shaking, really getting chilled. And we used to always keep blankets in a warmer in the delivery room or in the birthing room, so we could cover up mom because we tend to get pretty cold. So remember that.
See, Kristen's right here handling the comments, and I think she should be the one sitting here because
Yay.
I feel kind of out of place. But,
Well, the dads do the deliveries a lot of times.
oh, yeah, well, I'll be the one passed out over there.
No, you won't. If you see things, I watched a bunch of films of deliveries before I went into medical school early on, so I would be familiar with what it's like. Now it's just routine.
Beth said she has a friend that's in her 50s who is pregnant.
50s.
Someone else asked, what was the oldest woman you know who naturally conceived? My doctor said I was the oldest one he knew. I have something else. At what age, how old should you not have a baby?
Well, it seems to me that if you're having menstruation, you can have a baby. See, the thing is that after the age of 40, statistically, the chances of having a baby that is genetically impaired in some way go up a little bit. But it's not like if you're 45 and you have a baby, you're going to have a 50-50 chance of having a quote baby. I mean, it will go up from 1% to 2%. And again, if the father arranges this.
Yeah, if the father, I think it's totally in the father's hands. If you get pregnant, then he means for you to have that baby or to have that experience.
Family Roots Farm says anything to help with morning sickness. Not pregnant now, but would be nice to know for number 4.
Well, always use ginger essential oil. But you can use ginger. Is anybody out there growing ginger?
We grow ginger.
Good. Okay. So you should have ginger around. You can, it might be that if you, really chop it up and grind it and squeeze it and everything and take it first thing in the morning, that will help. I just use the oil because it's very easy and it's safe.
Accessible, yeah. I mean, it's
I've seen people use the wristbands that people use for motion sickness. I don't know whether that works or not.
Where would you put the ginger oil?
Oh, to take. Take it by mouth.
But
Well, actually, you can do it anyway. If you're using essential oils, if you put them on the skin, it gets into your bloodstream. If you breathe them, it goes into your bloodstream from your lungs. If you put it on the roof of your mouth, it goes into your bloodstream. Under your tongue, it goes into your bloodstream. So it's getting there. It just takes longer if you ingest it and it goes down into your stomach.
Someone said peppermint oil, diffuse 3 drops of the oil next to your bed to help with morning nausea.
Yes, yeah, peppermint's great.
Ginger, wintergreen, lemon, and frankincense will also help with morning sickness.
I think this is more suitable now, so.
Hey, YouTubers. He's hilarious.
Yeah. Well, you get a couple of women there talking about pregnancy. I'm sitting there like a bump on a log. I don't know nothing about this.
Maybe we should move that closer. Someone was talking about blurriness earlier. Blur the camera.
Oh, the blurriness. Okay.
See, it doesn't look that blurry to us, but on here.
Is that better?
Yes, that looks better to me. And it's looking better on there too.
Okay. Well, the thing is to stay well nourished, and if a mom is getting good foods and
everybody says I agree, Daniel. So I was right.
Get that bump in the log out of here.
Yeah.
But I think when I was having children, I didn't have to worry so much about pesticides and glyphosate and GMOs and all the other toxins that everybody is facing now. It's just so incredible what's out there. You've got to be really careful to keep your body. And I don't think many people understand that when you put a personal care product on your hand or your body, that it's getting absorbed right into your body. So you're toxifying yourself by using anything that has, oh, I don't know. I don't have anything here that I can read the ingredients, but if there's,
Lotion
oh,
or,
the lotions, yeah. I just use coconut oil with a couple of different kinds of essential oils, and I don't use lotions.
and the homemade shampoos and,
Yeah.
homemade shampoo, homemade deodorant,
Yeah.
all that stuff.
Right, toothpaste.
Toothpaste.
Yeah, the things to watch out for a lot are things like the triclosan. That's an antibiotic that's in the hand sanitizers, toothpaste. I can't think of all the things it's in, but it is an antibiotic. It's causing bacteria to become antibiotic resistant, and it doesn't do you any good. A good hand washing with plain old soap is the best thing to do, and you don't want to clean, you don't want to sterilize your skin anyway. That's where you have normal bacteria. If I take my hands and I put them down on a petri dish, put in the incubator, there will be bacteria all over the place because I have normal bacterial flora. It's called normal flora, and that's what's there to protect us. So you don't want to be sanitizing. I mean, sanitizing, sanitizing rather than making something aseptic. You don't want to kill all the bacteria. That's how surgeons get their hands all destroyed. They scrub and scrub and scrub and scrub and scrub. And when I would assist in surgery, I kind of scrub while somebody's watching me, and I kind of not scrub very much. I figured I'm putting on 2 pairs of gloves, for heaven's sake.
Yeah.
You need to scrub like that because it really does ruin skin. Yeah.
So, Dr. May I ask, at what point would you consider a epilepsy? No, what is it?
Is that an epidural?
Episotomy.
Oh, episiotomy.
Episiotomy, yes.
Okay. I would avoid it at all costs, at almost all costs. I don't know whether breech delivery you have to do that, but when you deliver the cervix, the cervix goes from being that to being that, the size, and it has stretched and stretched over time. And as the baby is delivering, sometimes if you don't control things, the baby just, mom, relax, breathe, don't try to blast things out. It will stretch and stretch and stretch. And I know you can use hot water soaks on the area of the perineum and really help stretch it out. You can actually do that before delivery. You can start stretching things out. So, okay, so what I'm going to say is if you cut, you've got a cut started, it's much more easier for it to split. You're better off just letting it go. And then you can always suture it if you have to, but most of the time you don't need to.
Okay, so I'll wait till later.
Yeah, I mean, there are times when a baby gets delivered too fast.
Well, okay, so
Yeah, you do that.
with my pregnancy, my blood pressure went too high.
Thank you,
So
Cassie.
they had to induce.
They had to induce.
Right.
And how would I have avoided that? If I was in nature and I was trying to have her naturally. I think it was due to genetically modified food.
But I mean, it does happen. It did happen before that. But, and there are herbs that you are to avoid in normal pregnancy because they will initiate labor. And so therefore they can be used to help move things along. Because, if you're in austere conditions and you're only 25 weeks pregnant, your baby probably won't survive. Because our first baby, the first of 4 that the father raised, I delivered him at 25 weeks, and in 1964 they didn't survive. So, if we go back to those conditions, they're much worse. You have to sort of think, well, if the baby if you're 35 weeks, you can try to induce. There's also something that I ought to learn more about, but there are the pellets that they put in the cervix to start opening it up. Are they made out of otter or seaweed? There's different ones now. They've changed recently.
I
But
use that with me.
did it help?
No, it was the stuff they put in my IV that helped.
Ibuprofen.
But when I started going, I went from a 4 to an 8 in 30 minutes. And my nurse was really rude. She was like, there's no way you're any further along. I just checked you a few minutes ago. She says, but I'll check you again. And sure enough, she checked me again. And they went and called the doctor. And by the time the doctor was running in the room, but they ended up having to cut me all the way.
Not C-section, you mean, episiotomy. Because if the baby was coming too fast and didn't have time for things to dilate, things like that happen. I do know, did they have you lying down when you were pregnant? Did they have you lying on your left side? That's what we used to do way back in the 80s, is that if somebody was going through joint hypertension, things like that, we have them lay on their left side because it takes the pressure off of the vena cava and helps you get a lot of fluids out. Also, it restricts salt. I'm not sure that's a good thing to do. But the other thing we used was magnesium. We used to use IV magnesium sulfate, which really will bring down that. And you're even better off taking it through, through the skin. Epsom salt bath.
Yeah. David, our friend, overdosed on Epsom salt bath. He poured half a bag of Epsom salt.
Did he get so relaxed he couldn't get out of the bathtub?
Yeah.
You got lamp.
It'll relax you, yeah.
So,
So I mean, those are things that you could do, if you didn't have medical care.
Bandana grandma said that Krista, the same thing happened to her for number 7. 7 kids, wow.
my mom
Yeah.
had 6 kids.
Grandma's homestead said sometimes nurses and doctors don't work with patients. They're in a hurry.
I look at the pictures and I'm just like, she was mean. 7 years later, she was mean.
I worked with an OBGYN when I first got out of college with bachelor's degree, and I was really like medicine and stuff, and I got a job with an OBGYN just doing kind of this Girl Friday stuff. And I still remember that I just did a blank. What are you talking about? The problem was he turned out to be Jackie Kennedy. I didn't get to go to the White House, but the deliveries. If you have your baby before midnight on December 31st, you get your tax deduction for that year. And there were a lot of babies born the last day or two of December, and they were not being born naturally. They were a lot of inductions and all that kind of stuff. Plus, the doctor wants to get out to the New Year's Eve parties, and it's just a lot of stuff that people get in there and mess around. I used to go to the doctor. We were in a different state with every baby, and so I had to go find a doctor. I was with La Leche by then, and so they educated me on a lot of stuff. And I just would go into the doctor and say, well, this is the way I have babies. You want me to be the patient? You may deliver. You may help me with my baby, but it is my baby.
Oh, just a little bit. There you go. Dr. Pat, what do you think of DOULAS?
Doulas?
Yeah.
My daughter-in-law is a doula. I think they're great.
What is it?
It's a woman that sits with you through your whole delivery and helps you breathe properly and relax and helps you get in positions that are good. And I think they're certifications for doulas now. They're not actually delivering the baby, but they sure do help. They're a really wonderful partner. I delivered a lot of babies of moms who had doulas with them, and they're great. It's good to. Did this person do a doula or is using them or?
No. Beth asked. I don't know. She hadn't said. Beth, are you using one or want to use one or? More details, please.
Okay. So they just want you closer to the mic.
Oh, me?
Yeah.
Oh, my voice doesn't carry very well. Okay.
We'll get it right.
Okay, I'll talk more. I'll talk louder. Don't forget gloves to protect yourself. Get some books.
Would a third C-section be risky?
Hold them.
Yes. Every time you're cut into, I mean, you mean as far as having a C-section or as having a vaginal birth after C-section?
She just said, would Nelson's Homestead said, would a third C-section be risky? I don't know what she's wondering if having a vaginal birth after that or just another C-section. I guess you heard her, so I need to shut up.
No, I didn't.
No,
Okay.
She heard you.
She heard me, okay.
I got it. I can handle the
Oh,
comments.
wait, that's my job.
Uh-huh.
Just debug my job.
I see, okay.
Well, the one time I can debug this job because it's a topic that I know nothing about. So I'm just going to say
That I chose.
Yeah.
Well, it's always,
I'm saying lots better.
yeah. I think once you've had a C-section, it's a definite possibility to have a VBAC. I know a lot of people have done it. I know there is some risk, and I think that's up to the mother to decide what kind of risk she wants to take. Because the uterus has been cut through in a different place, and most of the time when we've had a cut and sutured up, it's stronger. But who knows whether, there have been instances of a torn uterus.
Well, she says she has small bone structure, so she has to have a C-section. So with her third child, it'd be another C-section.
Uh-huh.
So that's what
Is
she
there a
asked.
way?
Is that risky for 3 C-sections in a row?
Well, some people have a lot of them. I mean, I know I guess one of the women I worked with many, many years ago had 5, I guess. It was a long time ago.
Somebody wants to know what's the largest and the smallest baby you ever delivered?
I don't remember specifically. I think probably a 10-pound baby.
Whoa.
But
That
that's
was a big baby too. So.
my biggest was 8'1". But it really doesn't matter. It depends on how you're built. One of the things I would like to get into is if anybody is pregnant, is the types of exercises that a person should do. How many people know about squatting?
Squatting, I don't know.
Squatting. Okay.
Well,
if you look through the history of humans, we have not had sit-down toilets for most of human history.
Mm-hmm.
Throughout life and pregnancy, people have gone into the woods and squatted.
And that strengthens the uterus?
It strengthens all of your delivery muscles and just the whole process. I always like to look back at the children, the Hebrew children during Moses' time, because the Egyptian women sort of were sitting around doing nothing. And the Hebrew women were working very hard making the bricks, and they had to squat. I mean, they didn't have like some kind of an assembly line that they stood at. They sat on the ground and made bricks, and they squatted all the time. And, the midwives told Pharaoh, well, the Hebrew women are not like these Egyptian women. We get there and the baby's already born. Well, that's because they squatted all the time. Well, of course, it had a lot to do with father's intervention. But still, I think that's a good thing to remember. So, a lot of squatting, a lot of, good exercise, a lot of walking.
They're talking about, my midwife made me do squats to help with labor. I see it on movies all the time, women in the squatting position.
Yeah. You know that position they used to deliver everybody, it's called the lithotomy position, and on the table with your foot up in stirrups. It's called the lithotomy. position. I hope you don't mind my being graphic, but that's the position they use to take kidney stones out of men. That's why it's called litho is stone and otomy is to take it out. You want to know the history of the word hysterectomy? It's they used to believe that women got hysterical because they had a uterus. And so they would take the uterus out to extract the hysteria. So when you ectomy, you're taking it out like an appendectomy. And so they're removing the hysteria from the woman. I always thought that was pretty funny.
Yeah, it's like, goodness.
Somebody wants to know how many babies to one woman have you, what's the most amount of babies that you've seen one woman have?
Yeah, I attended one birth with this mentor that I really liked, and it was the woman's 8th baby. And I'm thinking, oh, this is gonna be really a piece of pie. She said, She said, these are the most dangerous. Once you start, because then that's when the uterus tends to relax too much, or so. Yeah, 8 was the most.
8 was the most. Yeah. I know a few with 7. So when somebody just had 6, they're 6. So,
well, the 8th, this woman had a perfectly normal delivery. So she was careful with.
If you had to deliver a baby in a grade down scenario, what position would you recommend the woman be in?
If she can squat, and then she has got her muscles ready to squat, because you don't want to start learning to squat when you're in labor.
Like if she's done it every day of her pregnancy.
Right, it would probably be the best way to do it. The left, on the left side with somebody holding up an arm, that's a great way to do it too. But the very worst way is to lay on your back. But if you have to, you have to. Sometimes.
Well, to me, that makes absolute sense. I get that.
Yeah.
I get that. Yeah. And I was thinking the squatting position. I know. I just understand.
No, I'm just wondering how long should you be working on it through the whole 9 months practicing the squatting position? Okay.
The women that did the best, throughout history were the ones that were squatting before they even got pregnant.
Mm-hmm.
And they just continued.
Have you ever used a birthing stool?
No, I haven't. Just because it hasn't been around. It wasn't around. You got to understand, I delivered about 100 babies during my residency, and that was the latter part of the 80s. And things have changed a lot since then, so they probably have birthing stools now. So, but I know that's what they did back in Abraham's day. And how old? Somebody asked how who's the oldest woman I know of? Sarah.
Yeah, at 100 years old.
Yeah.
What do you think about submerged deliveries?
I've never done one. I know there are a lot of people who like them. I think you want to be careful to get the baby. Well, the baby doesn't need to breathe as long as the placenta is attached, because the baby's getting the oxygen through the placenta. So, yeah, I'm sure it's. I think there have been accidents, but it's warm and nice.
we got 5 minutes. Hey guys, we got 5 minutes. If you want a question in real quick, go ahead and get it in. But go ahead and tell them about the Homestead Network and everything. Well,
everyone be sure and go check out www.thehomesteadnetwork.com. And my husband is operating my computer, so I can't get to the website right now.
Well, y'all know
I believe. I don't want to quote it incorrectly.
Well, it's Off-Grid Kid
at 5:30 Eastern.
46 degrees north. Wayne's World. Big Bear Homestead.
And he's playing with his deceit as he says all this.
Yeah, I'm sitting here twirling my deceit teats. I'll show you. Watch out for a second. I'm sitting there going, yeah, and Wayne's World, Big Bear.
Excuse me. Mama?
Chris is not pregnant.
No. Not that we know of anyway.
Yeah, then American Homestead, Deep South Homestead is before American Homestead. But that's off the top of my head because I like Saturdays. Thank you, Simply Circus. She posted it to everybody.
Be sure to go check out all these channels and subscribe if you haven't subscribed. And go check out our Instagram, Twitter,
And if y'all would like to
and
us
Facebook.
to have some more talks with Dr. Pat and make some more videos, please put it in the comments below and maybe we can show her about YouTube and maybe we can get her doing a YouTube channel too, because it sounds like a lot of information that needs to be out there. Everybody's sending their love for you.
Oh, thank you.
Yeah, everybody's.
She'll teach how to be your own medic or off-grid medicine.
Yeah, off-grid medicine, how to be your own medic.
Good stuff.
Probably sutures and stuff.
Well, yeah, I like to teach wound care because sutures are the very last thing you want to do. I mean, you
Yeah.
have to do it sometimes, but you're better off. A lot of other things to do better than that.
Yeah, we need to get on that topic.
Okay, let's do it. Let's do a wound care.
Okay. Do y'all want us to do a wound care video for y'all? Just put it in the comments below, and and she's willing, so I think we're gonna do it anyway.
I love doing this.
Yeah, thank y'all for everybody coming, and
Bye. Everyone told you hi at the beginning.
everybody said hi to you.
Hi, everybody.
And bye, everyone.
Bye, everybody.
Please, yeah, everybody's saying please, please, yes, please, please, yes, please, yes, yes, wound care. Thank you, Dr. Pat. Would love to watch Dr. Pat on YouTube. Bye, Daniel and Krista. Beautiful. Bye, Daniel and beautiful Krista and Anna. Yes, bye, Anna. And people need to know. Yes, please. And everybody's saying hi to Anna now. Hi, Anna.
Starting over again.
Hi, what a nice little girl. You don't know her very well.
Whoever that was. Come paint for me.
So had to, hey, Homestead.
We could do the.
Sorry, we're just about the end of the show, but I'm glad you made it though. I'll see y'all later, and we really enjoyed the show, and we're gonna take as many videos as we can this week. I don't know if anybody's behind us. Is anybody behind us? Because if there is, we're going overtime. We're over when we shouldn't be here, but I don't think there is. But we'll say our goodbyes, and we appreciate y'all coming and tuning in. All right.
Bonnie.
Obey awesome. I love you in here. Bye, everybody.
Bye, YouTube friends.
Bye.